It was truly a life-changing experience for me. It opened my eyes to the world.
I think one of the hardest parts of the trip is just reconciling all the emotions and feelings.
This trip has been incredible and heartbreaking and frustrating at times and so incredibly fun and joyful at times.
I had no idea the impact that it would have on my life. I had no idea that much of my life would be shaped by those 5 weeks.
MEDRIX partners with universities in the United States and universities in Vietnam to do a nursing exchange program.
So we started out our experience in the villages where we worked with nursing students from the university and preceptors that they provided from the university. And I was able to really understand the global nature of nursing and how the profession of nursing makes such an impact on communities at the smallest level up to the higher levels.
We have spent a lot of time also in the pediatric hospital here, going from different units and learning from the doctors about diagnosis and treatments and differences between the US treatment and Vietnamese treatments and how we can help it, but also just learning from it and learning the differences and how we can incorporate that into our practice in the US.
When we take American nursing students to Vietnam, it's to partner with Vietnamese nursing students and Vietnamese physicians.
Working with the Vietnamese students provided an exceptional opportunity to interact with those that don't have English as their first language, which is very common in United States hospitals due to the diversity of America. Working for 10 minutes just to basically understand where a patient is at, and there's a huge language barrier.
So we learned a lot about nonverbal communication and how to work together to assess patients, and learning how they assess patients and how we assess patients, and coming together to teach the patient was a good experience.
So our work at the hospital was primarily based where we followed a doctor for a portion of the day. So we followed doctors such as cardiologists, oncologists, respiratory doctors. We got to just assess hundreds and hundreds of patients and see what the doctor was using clinically to make his decisions.
For us to be able to come and learn from the doctors and just try to grasp their huge amount of knowledge that they're trying to share with us, and learning about these diseases I really knew absolutely nothing about when I came here. It's really easy to see the lack of resources and what they could be doing and could have if they had more resources, but I think I've learned to see beyond that and see what they are doing, that they are very skilled, that they've been able to do things that I would never see in the States because they have a fifth of the people doing it. I think that because they have lack of resources, they're very careful about having stewardship with those resources and taking care of them and using them wisely.
I think that I will take this experience and utilize it for the rest of my nursing career.
The biggest thing this trip has done for me is it's in some ways brought me back to why I wanted to be a nurse in the first place.